All right, welcome everybody. We're really glad you're here with us today. My name is Scott from Blue Circle Health. I've lived with type 1 diabetes for over 45 years. And just really quick, for anyone not already familiar with Blue Circle Health, we support adults with type 1 diabetes through a free virtual clinical care, education, and support program. And a big part of that is helping people feel a little more supported, a little more confident, and a little less alone in all of this. Now, today we're talking about something that many of us living with type 1 diabetes might experience, but it's not something that's always easy to talk about. And that's the feelings of shame and guilt and all this emotional baggage that are often attached to our blood sugars. Whether it's something that we feel like maybe we should have done differently or just that constant pressure to always get it right. Those moments can add up and over time they can really, really weigh on us. But we all know diabetes is complex. It's not a simple math equation that always works out. And yet, it's always very easy to feel like those numbers are a reflection of our self worth. So, we're creating a little space to talk about that today. We're going to explore where those feelings come from, how they show up in real life, and most importantly, how we can start to release some of that weight and relate to our blood sugars in a healthier and more compassionate way. But before we get going too far, I do need to cover a couple of quick housekeeping notes. Feel free to use the chat throughout the session. I'll be keeping an eye on it as we go. The session is being recorded. Participation is completely voluntary, and anything you share may be visible to others, like messages in the chat, for example. And finally, we're not providing medical advice or endorsing any specific products or brands. For anything specific to your situation, we always recommend talking with your healthcare team. All right. Thanks so much for your patience with that. I'm really excited for this conversation today because we're joined by someone who brings both clinical expertise and a deeply human approach to diabetes care, Jenny Fernandez. Jenny's a registered dietitian with Diabetes Digital, where she works closely with people living with diabetes to support not just nutrition and blood sugar management, but the emotional side of living with this condition as well. Jenny, thanks so much for being here with us.
Yeah, thank you so much. I'm so excited to be here and get to talk about this because this is one of my favorite things, one of my favorite topics to really discuss during sessions with clients. Because, like Scott mentioned, it's something that many of us sometimes maybe live with. I did myself for many years, and I didn't never had anyone to really kind of um, talk to about that. And it wasn't until I became a dietitian and started seeing other dietitians that work with people with type 1 and also live with type 1 really express a lot of that shame and guilt and how to um, manage it, right? So I hope that during the session, we can explore ways to reduce some of the shame, reduce some of the fear, create some more curiosity and support and more support that's sustainable, right? And is rooted in self-care. That's one of my biggest things. I want care to feel like it's part of treating your body a little bit better, adding a little bit more compassion into how we manage our diabetes. Okay.
Right. Ready for your slides? We'll get those on the screen here.
Yes. Oh, yes. So here is my quick little intro slide. And just another disclaimer too. Yes, as Scott mentioned, everything in the slide is for educational purposes only and not individual medical or nutrition advice. Okay, so a little bit about me. I have been living with type 1 diabetes for over 20 years. I was diagnosed really early on at 8 years old. I also like to always mention what I'm using just for one, so you guys are aware, but also because I do feel like it is a sometimes more of a point of privilege that I might come from having a CGM and a pump as my method of managing my diabetes care. I'm originally from Florida, but I live in Austin, Texas right now. As Scott mentioned, I work in supporting people living with diabetes through nutrition. I am a huge coffee lover. I love exploring new coffee shops in my area. And most recently, something just that I started to do is become a Pilates instructor. I love movement and just finding fun ways to move my body. So that's just a little bit about me so you guys get to know me before we get started. So, why are we here today? And I would love if you guys in the chat maybe write in some some reasons why you might have signed up for today's webinar. What about it kind of drew you here? Anything that you feel like sharing, maybe something you hope to get out of today's session. I would just love to hear your thoughts on today's topic. But maybe why we're here might mean managing blood sugars day in and day out feels overwhelming, right? A lot of us know how much attention and care comes after looking at our blood sugars. Many of us maybe have had dozen interactions with our numbers on the daily, and that might carry a lot of emotional weight, right? It might also carry a lot of self criticism and negative self talk, right? Maybe you feel like numbers are good or bad, and you're kind of stuck in the good or bad, and you want to move away from that. Um, which I do want to say is a total normal and valid feeling in how you feel about numbers, but it's great that you're here and wanting to create more of that curiosity, non-judgment approach. Um, Maybe you're here because you realize too, like the highs and lows happen, but how do we come to terms and accept that and move in a way that we're rooted in that self-care for our body and still want to continue to care for our health and improve maybe our diabetes management.
Got some great comments coming in from the chat. Several people saying they felt shame and guilt since diagnosis, feeling burned out, things are harder to control, and don't feel like they have a support system. Feel all of the above, they say. So lots of good stuff. Thanks for sharing in the chat, everyone.
Yeah, thank you so much. Yes, definitely. Um, Definitely, I think, it's something that I heard was like the support piece, right? And I think being involved in webinars like this is great because you can see how there's other individuals out there that also resonate with what we're talking about and maybe how you feel. So yeah, thank you guys so much for sharing. Okay. So now another question for the chat. How many times a day do you check your numbers? Like what would if you had to put a number to it, what do you think it is? What does that look like for you?
This one's kind of a tricky question for those of us with CGMs, right? But so I'm gonna count this as like how many times do I look at my number? And it's a lot. I like to have it in glanceable locations, right? So maybe a little widget on my desktop or on my watch, things like that. So I would say I probably look at it maybe 3 or 4 times an hour at a minimum, and way more than that if things are not going as I expected. So we've got some comments coming in, at least 10, 8 to 12, all over the place with these numbers. So yeah.
Yes. Yeah. Yeah, exactly. And you're right, Scott. The CGM, right? We know that that number might be really high because we might have it in different areas. I also have it on I love having the widget on my computer screen. I'll
Yeah.
just glance at that instead of looking down at my phone. So definitely.
Yeah, there's a fun comment, 100 plus times a day with CGM stimulation. I totally get that. I totally get that. That's so fun.
Yes, exactly. I totally get that too. Yeah. So all of this and every time we're looking at that number might bring up certain emotions, right? Like Scott mentioned, I might look at it more when things might not be going as I planned. So that's kind of what we're going to talk about today is we still want to have that attention to our numbers and still want to make sure we're aware of where we're at. But how do we kind of navigate maybe some of the emotional piece that also comes up with as many times as we check? Because we know that with the emotions, if we are constantly then feeling those negative emotions, that can lead to diabetes burnout. And you might have at one point in your diabetes management found yourself on the opposite side of things where it was, I'm not even looking at my numbers for a couple of hours because I feel so overwhelmed, right? Because I've been there. I've been on the burnout side where I've been like, I don't even wanna look at it, right? So hopefully we can bridge some of that today and talk a little bit more how to navigate that. Okay. So let's get into maybe why some of those emotions come up. I know I'm sure a lot of you guys can probably point to specific scenarios in your life, in your day to day that have brought up some of the emotions. But kind of zooming out a little bit, I think sometimes we're easy to see these numbers as good or bad, quickly label them, add that morality piece to it. And I encourage people to not view the numbers as good or bad, right? And we're going to talk a little bit more about that. Um, Past experiences. So maybe you've been to your doctor's office and they see, they look at your CGM graph and they're like, you did amazing. This is great work. And inside, you're probably like, do you know what it took to get here? All the things I had to do. Maybe it was a stressful period, and that is, a stressful period of really being on top of it, and it was actually burning you out, but you finally got that praise. And so when you no longer, you had that praise and you maybe step out of what those numbers look like, you might feel some guilt for, oh man, my doctor really praised me on that hard work, even though it was so hard to manage it that way. And now that I'm not, like, am I bad for this? So sometimes that brings some emotion. Social media, in comparison. So I bring up social media because I love that we now have a lot more people speaking on social media about their experiences, talking about living with type 1, managing. There's some great people out there really talking about just advocacy, which I think is amazing, but also tips and tricks, right? It's great. It kind of creates a little community there. However, I think there are some parts about social media that can be really challenging when people are posting their graph, and then we start to compare. And we think, oh no, my numbers don't look like that. My graph doesn't look like that. Is there something wrong with me, right? And that can create some emotions that come out of how we interpret our numbers, right? And we all understand that our bodies are so different and we all live such different lives, and even the way we manage diabetes person to person is just very different, right? Different tools, different techniques, the way different foods affect me might affect you different. But that's definitely something that comes up. Um, so this all these different things can make it so much harder to view the numbers as neutral. But what we're trying to look at is how can we start viewing them as helpful data, right? How can we get a little bit more curiosity around them? So I always love to talk about numbers being like the weather. Um, this was actually said to me by an endocrinologist, and it just really resonated. And I thought that it was such a helpful way to reframe when we think about our numbers. So when you look at the weather, we know today, for example, here in Austin, it's quite rainy, but on the weekend, it's going to be sunny, which is awesome. So when we think about our numbers that way, one day might be rainy. Maybe our numbers don't look in the range we wanted them to be. But then the weekend comes and those numbers are a lot better. Maybe they're exactly where we wanted them to be. And maybe we didn't do too much different that from those days, right? Maybe we even ate the same foods. There's so many things that happen, but that's one thing, right? That it sometimes it can be the same habits, the same routine, but our numbers fluctuate just like the weather. Also, like the weather, maybe you, before you left your house, you checked the weather, you saw it was going to be rainy. So maybe you packed an umbrella. You said, I am prepared. I have all the things I need to handle the weather. However, um, that rain ends up not happening. So we had the gear, we had the tools. Same thing with sometimes with blood sugar. We might have all the tools. We might exactly know, okay, I've had this meal before. I remember what happened to my blood sugar last time. I'm going to approach it differently. And it still doesn't go the way we imagined it would go, right? The plan we had set. The numbers are still, maybe we dropped a little too low this time or went a little too high. Um, that we predicted, but Same thing, right? Sometimes we have the tools and we we still don't perfect what where we would like to be with our numbers, right? And that's a part of navigating diabetes. Is understanding that sometimes we may be the most prepared, but our bodies are going to do something different, and that's okay. And another piece of this too is I also like to normalize that it's okay to have preference, right? It's okay, just like the weather. You might love when in the mornings it's, a nice 70 degrees. You might not like when it's 90 degrees first thing in the morning. That's really hot. But just like that, you can have preferences over your numbers. You can have a desired range where you would like to see your numbers in, and that's okay. But sometimes where that lies is then it can create some type of we don't want it to create judgment, right? When, oh man, I really wanted my numbers to be in within this range and now I'm not, and now I'm self-judging myself. So we want to understand that things can shift, and more so, how can we react to those shifts? Another thing I often hear is, well, I'm nervous about where my blood sugars are because of complications. There's a big that's an often a big piece of it that I hear in sessions with patients is, um, I feel like I am hurting myself or hurting my body if my numbers are higher than they need to be, right? Um, but it's an important thing. I always reframe that as saying we have to zoom out a little bit, right? Because sometimes we get carried away in the one time incidents where the blood sugar went above range versus looking at, wait, what did our whole week look like? And oftentimes when we zoom out, we're like, oh my gosh, yeah, you know what? This whole week I did great. I was in that range that I wanted to keep my blood sugar in. And this was just a one time incident. And we know that one high or one low or even a couple is not going to be the reason why we have we see diabetes complications, or um, it doesn't mean we've failed the way we're taking care of our bodies, but it's more important to look at the trends, right? So as we're thinking about our blood sugar, are we zooming out and looking at our trends versus just like that quick glance on our phone when we see one number, we're like, uh-oh, whether it's double arrow going down low or double arrow going up if you have a CGM. Um, I know those are moments where like, uh-oh, but those are, instances, and we're aiming to create curiosity around those incidents, right? So I know this comes up often. So with that comes recognizing why we're checking, right? So I mentioned during the last couple slides, like creating that curiosity. So what does that really mean? Well, when we're checking, yeah, we wanna know, like, what that number looks like, but why? Why are we checking, right? We want us to ask ourselves, like, what are we trying to gather? So, maybe we're trying to gather information about, how a meal went, right? Maybe it was a new meal you had. Maybe it was a meal you ate out with friends. There's many different circumstances where maybe you just wanna gather just information on how an approach you did towards a meal. Maybe you want to gather information on how exercise is affecting your glucose levels. It's not about did I go high or go low, but how did I try strength training? How did that affect me? Right. And maybe gathering some of that information then tells us, okay, what can I tweak here? What can I how can I try to lightly prepare? Like have that umbrella with me for the next time. Um, it helps you guide decisions, right? So we look at our numbers and maybe that's going to help guide what we do for our next meal, or like I said, the next time you try um, exercise or a certain type of exercise. But we want to make sure that we're not taking it as, oh, this, I'm checking the number to evaluate how good I'm doing managing my blood sugar, meaning, like, I know, like, that's kind of sometimes, like, what we're looking at, but meaning how good of a person I am trying to navigate these ups and downs, right? And that oftentimes we wanna blame ourselves, and Another piece to that too, I think, is reminding ourselves we are doing the work of an entire organ, right? That's a lot. And I often see the, and I can't remember the exact number now, but I often see the one statistic that talks about how many more decisions somebody living with type 1 diabetes has to make. It's a lot. So we're making a lot of decisions. We're trying to do the work, even with the tools that we have, the work of a pancreas, right? Which is completely new to us. Okay. We're new to this, or we're not used to this. We don't want to add that negative self-talk about, oh, not being I'm being bad because I went too high, right? Instead of thinking about it as like research on how does my body react to certain things. So we're noticing patterns. And noticing patterns might come with, if it's helpful for you to take notes. If you have a CGM, I love to add in activities and add in all the things. So when I'm looking at the bigger picture, I can remind myself, oh yeah, okay, this is when I had some activity. This is when a night I did not sleep good, because things like that happen. Days I was sick, right? So that can be one way. Other times it's maybe opening like your notes app and just kind of jotting down like, okay, I tried this new meal and this is how much bolused for it. Maybe next time I will try something different and kind of jotting that down as a reminder. So really thinking about it as research on how your body responds, right? Um, and I want you to notice your first thought. So this takes a lot of practice of kind of being more reflective when it comes to thinking about the numbers. So looking at the number on the screen, but at the same time, pausing and thinking, what's the first thought that comes to my mind? Is it, you know, are you saying like, oh, I did something wrong or I'm not doing a good job? Like, is it a negative thought? And then at that moment, can we start to reframe it into a more positive thought, right? Um, And then just, yeah, we're creating awareness, right? We're creating awareness between the number and the meaning we attach to it, right? So again, it takes practice. And sometimes I will recommend that my clients just take one deep breath and then say, okay, what did I name out loud? How do I feel? What's the feeling? Just one feeling. Is it I'm angry? I'm sad, like just one word. And over time, you start to realize like what emotions these things are bringing up, and how then from there start to reframe them, right? So reframing, right? So coping with those highs and lows. Um, Instead of, okay, I I totally messed up. I'm just bad at this. No, we might want to ask, okay, what might I experiment with next time? And that might come from maybe I realized, okay, I didn't really pre-bolus for this meal, which sometimes happens. We are busy individuals. We might be hungry at the time of a meal. So maybe we say, let me experiment, before I discard trying this meal ever again because my blood sugar went out of range. Maybe I will just experiment with, okay, let me just try to pre-bolus. But maybe you're like, nope, I'm really good at pre-bolusing, but I still see the numbers elevated. Well, maybe there's nothing else we can experiment with, right? When we think about nutrition, sometimes it's increasing our protein and fiber with that meal that helps it, have better blood sugar balance along with the meal. Sometimes it's Sometimes it's not even what we're doing, and that's a good reason why we wanna do some of this research, because sometimes it comes down to, maybe it's been a while and my settings need to be adjusted, and there's nothing wrong with that either. There's nothing wrong with settings being adjusted. Or, when I say settings, I'm talking about a pump, but if you're not on a pump, maybe it's just some of your ratios, right, need to be adjusted. Maybe the basal needs to be adjusted. So this is where it also is helpful to kind of take in some of that research, so we can also know that like, hey, it might not even really be what we're doing per se, but more so the way that, the way that the insulin's kind of working for me at this moment. And then of course, like those are conversations you can have with your endo or your providers. But Yeah. Another thing is like asking what's outside of my control, right? Because sometimes maybe the blood sugar became out of range because of the options of food we had, right? Or maybe we had a really busy day and now we didn't have time to have a meal and now we're going really low and maybe you're a little bit um frustrated because we're low and we need to stop what we're doing to treat and there's a lot of things that happen there. But there might have been things outside of your control. You might have had a really busy day, back-to-back meetings, or maybe you were at work or you had a really active day and things happen, right? And then if you are on a CGM, because it's giving you so much data, I do feel like really trying to use that data as curiosity, right? Curiosity to how do my levels change throughout the day? What happens outside of food even? I know I've talked a little bit of food, but I also like to even think about what happens when I'm stressed? Like what's the response here? What happens when I don't get good sleep? What happens when I do more activity? What happens during just other circumstances that are not even food related. Sometimes that also can give us some ideas of things that are going on. So we're not using it as surveillance, like, okay, I must stay within these bands or within these lines, but more so the curiosity aspect of what happens during the day, since you have all that information, right, with the CGM. And then this allows us to create small shifts, right? So every time that we do see a low or a high, we can start creating some small shifts, right? Out of the curiosity of the things that we started to think about that maybe we can change or maybe we can look at next time. And that over time, those small little shifts that you want to do create more sustainable shifts that over time you see that might improve some of the management, right? Okay. So I talked a lot about like negative self talk too that might come up. So remember, sometimes our thoughts are not always facts, right? Our brain sometimes thinks things, but it's not necessarily always a fact, right? Like you are not a bad person because you had a high glucose level or you went low and overtreated. That doesn't make you a bad person. And then numbers are just data, right? Numbers are just data. They are just letting us know how our body is responding, how our body is feeling. And we're just curious about what the data is telling us about our bodies. So, some thoughts, like I mentioned earlier, that might come up is I messed up. I should have done better. And we want to learn how to recognize when those thoughts come up and reframe immediately after we think something like that. Like pause and say, okay, how can I view this in a different lens? Remind yourself that this is just information. Remind yourself that you're exploring your body and still learning what works best for you. Reminding yourself that your body might not be a problem to fix. You want to maybe support your body in the best way possible, but you're not something to always constantly work on and fix and fix and fix, right? It's more so finding that support. So the goal is to reduce emotional burden and reinforce self-compassion with ourselves. Um, so I would love if in the chat you can think about one way you would reframe maybe some of that self-talk that might come up, some of that guilt or shame that might come up for you.
Yeah, there's some great conversations happening around like using the data around foods or a situation to like practice getting it right. You know, if the first time you have a complicated meal or maybe something that just I struggle in um accurately carb guessing meals that are one that are not made by me, so I don't know exactly what's in them, but also ones that have a bunch of stuff put to like combined, right? Those are just they're hard for me. But the approach is like was shared that just I deserve to have this meal I enjoy. I'm gonna keep working on it over and over again until I dial in all my diabetes settings just right around it. And I love that approach. So Jenny, I love your emphasis on curiosity. I think Curiosity is one of the strongest attributes that we can have in living well with diabetes. It's we approach these situations with, like, well, why did that happen? Or okay, that happened this time. What do I want to try differently next time? So I really love that.
Yeah. Yeah, absolutely. I agree. I know there's many times where, even I know you said, Scott, you've been living with type 1 for a while too. It's like I always get asked, like, when will I know it all, like learn and feel an expert? And I'm always telling people, I'm still learning. I'm still
Yeah.
always learning. And it happens, right? We're always kind of learning how our body reacts to different things and different foods, and there's always still challenges. I also struggle with like, yeah, meals that are very combined. I just say, you know what, I'm gonna do my best. I love the approach too of I still deserve to have this meal. I still deserve to be part of this, experience or celebration. I think that that is such a great way to view it as well.
The other thing that comes to mind around this topic too is even for something that I feel like I know how to handle it in most cases, it doesn't always work. And I oftentimes think about it's just a reflection of this miraculous, mysterious human body that we like with diabetes, we know a handful of things that can influence our blood sugars, but even after all the medical science, we don't know everything. And sometimes there are times when you do everything you know to do, and it just still doesn't work out, even though it did last time, and it probably will next time. And sometimes we just have to have grace in what we're seeing.
Yeah. Yeah. We are literally trying our best every single day, every single one of you, even if you forgot to do something. Like I always mention, like, even if you forgot to bolus, I know that sounds like so silly. And it's like, how do you forget the bolus? How do you forget your insulin pen at home? Those little things are so silly, but we are still human and we are trying our best every single day. So that definitely, yeah, that resonates a lot too.
Another comment, came in about stress being a big factor, and I want to point out too, so absolutely right, stress is a huge factor, and I think we often don't give our stress enough credit when maybe it's a good change that's happening, but it's still change and it still is stressful, even though it's a positive change. And so I think it's easy to think of stress always as like the negative stress, but sometimes that stress can be positive and still have a negative effect on our blood sugars. Complicated.
Yes. Yeah, I mention that all the time with clients when we talk about exercise because exercise does give our body stress, but it's a good stress and it
Right.
can sometimes elevate our glucose levels. So sometimes it feels like, oh, should I even be, exercising because this is the outcome? But no, absolutely. We know it's great for our health. And it's just about like getting more curious and fine tuning things. But that's a great example of how stress can sometimes be good for us.
Yeah. Yeah. Great comments in the chat, everyone. Keep them coming. Thanks.
Yes. So we're building that curiosity muscle. And I call it a muscle because just like when, we are just talking about exercise and exercise is one of those things that in order to lift heavier or challenge yourself, you have to continuously be exercising, right? And it's the same thing here with this curiosity muscle. We have to continuously use it every single day as much as we can to make it stronger and stronger, and over time, it becomes, the way you start to immediately view things, right? You'll notice as you start to really think about shifting from judgment to curiosity that it naturally starts to happen. And I will tell you, when I first started, um, practicing more my curiosity muscle and thinking about things with a more mindful approach, I was like, this is I'm not gonna get it. I'm like, I'm not getting it. I'm trying. And now as I'm working as a dietitian, I've realized like, oh my gosh, I actually do this. It just naturally comes up over time, instead of that judgment like it used to. So asking, like we mentioned before, like maybe what influenced some of the changes that we saw in the glucose. Was anything different today? These are great questions that you can ask yourself maybe at the end of the day if you're like kind of looking at like what your trends were. Um, Even I think this can be really helpful. Thinking about what's in your control. And I know there's some things on here that are not always 100% in our control, right? And when I say insulin, I mean like the insulin dosing, like your settings, right? Like that the settings um might be something that work for you, right? And but I know insulin's not always something that's 100% in our control. But maybe the insulin timing is something when possible. Sometimes I know again that might not be in our control, but it could be something we work towards, right? We work towards improving the insulin timing. Food choices also has a little asterisk because I know sometimes we are eating out or we get invited to go somewhere and we're not really sure what people are going to offer or cook or how they're going to cook it. But at other times, maybe food choices are in our control and we can think about, experimenting more with the food choices to find what best kind of supports our body. And checking, I feel like is one in the way you monitor and the way you look at your numbers, more in your control, right? Again, I understand that some of these things also hold their own privilege. Um, and I definitely don't want to dismiss things like our social determinants of health that sometimes do not allow for some of this control. But these are just things I point out as things that we can shift our goals toward. The goal isn't maybe always to just solely focus on the number, but maybe expand a little bit on the other things that might influence that number, right? Out of our control, these are just a couple other things I listed. Our hormones, especially as women, they change and they might affect our glucose level. Stress, like we mentioned, illness, and just random things that come up. Those things are out of our control. So sometimes too, when we're looking at the numbers, it's important to kind of, reflect on what are the things that maybe were out of my control. What happened in the day when I am feeling this shame or guilt around my number that might be able to help me see that there's other factors here that come at play. And I talked about the pausing, but I think that's kind of how you gently start to build that curiosity control or curiosity is to pause and kind of think about what's happening. How do you feel? Just even starting to notice like what is the feeling? Okay. So another reason why I am so passionate about, I think, reducing shame, especially around glucose levels, is because reducing the shame and the guilt will increase engagement. And I mean, increase engagement into you wanting to look at your diabetes management a little bit more, because if not, we are burning out, right? We are quickly to burn out. I mentioned the story earlier where I've had periods of time where I'm like, I don't even want to look at my glucose levels. I don't. And that happens. And that's burnout. Those are your signs of burnout. Those are your signs of, okay, I need to rethink of how am I approaching my care. And it improves problem solving. Over time, you become better at recognizing maybe, oh, this is a new meal, but I've had a similar meal before where it was maybe high fat. And I know that on my pump, I can do a split bolus, right? So you become better at recognizing like patterns among meals, maybe even patterns among, oh, I know when I wake up, I tend to see my glucose elevated first thing in the morning. And that kind of then shows you like, oh, these are the changes I can make, right? Because you begin to recognize your patterns. So you become a better problem solver. Um, and those focusing on those patterns is what then helps you not to shoot for perfection, 'cause that's not the goal here. The goal is not perfection or to get it all, understand it all, but just notice where we can make those small shifts. So reminder again, you can do all the right things, but that doesn't always mean that we're gonna get all the expected outcomes. So we have to have a little bit more self-compassion for ourselves and understand that we did our best. We are doing our best every day. And I always like to remind people, you don't have to do this alone, right? I think finding, providers that are collaborative, right? Finding a care team that listens to you. I think it's helpful having family members, support groups, joining sessions like this where you guys in the chat sound like everybody kind of resonates with a lot of the things coming up. So knowing that there's other people also feeling the same feeling you are feeling. Um, so you're definitely not alone in this journey as well. So takeaway slash a little reflection. What's one small shift you think you want to start to implement in the way that you interact with your numbers? What's one thing that you maybe want to try? I also kind of put in like if you need support, like seek out, like I was just saying, support groups, diabetes meetups in your area if that's possible, or if you have any, those are very, very helpful. Just being around other people who also live with type 1 or diabetes, journaling, reflecting, if that's something that you really like, I think that can be really helpful in kind of getting out some of the emotions that come up and we feel. And like I mentioned, talking to someone trusted.
Annie, that was fantastic. Thank you so much. And it's clear to me why you are so popular at your organization and doing all the things that you do. You're very good at this. So thank you. Um,
Me.
I want to talk a little bit more about some of the things in your control versus out of your control. And one of the comments that came in earlier was about, boy, my numbers are just all over the place. I can't spot patterns with, to save my life with it. And I, as you were presenting, I had the thought that maybe there's some structure that someone could put into place to try and make some of the things they're experiencing the same, right? So then they can be curious and observe what's happening there. So, for example, maybe eating the same thing at the same time and just experimenting with that. Uh, but what are your thoughts on a topic like that?
Yeah, that's a great question. I also recommend doing something similar like that, or even just breaking it down into, okay, let's start with where we're noticing the most with the patterns, right? And maybe that's breakfast. Maybe you say like, oh, breakfast, I notice more variability. So maybe we just hone in on that piece and start with just the breakfast component and look at just that piece because it can be really overwhelming when it's all day long. Um, and we might not even know where to start, and it's like, which one's causing the other one to kind of
Totally.
be the the reason why the numbers might look a little bit more sporadic, but definitely, I think honing in on just one piece and just getting kinda getting curious, like, "Okay, let me eat the same things, let me kind of do the same pattern, but let me only look at the breakfast component, and I will slowly then observe the other times of the day to kind of see what that pattern looks like."
I love that approach. I also, as you mentioned, overwhelm. I am not very, I don't enjoy, and I find it very difficult to look at my own diabetes numbers, my data, my charts, my graphs. And it's almost like I'm too close to the data. I'm too close to my day to day experience. And it just feels like it's overwhelming and I don't like it. So I step away from it. And I think I always need help looking at my data to find patterns and trends. And the benefit of bringing in like a third party, just a second set of eyes, creates a little bit of space there. And I feel like we often, living with diabetes, we feel like we need to be good at it all. And there are some things we do need to be good at to stay safe, but there are also other things that we can, I think, pretty comfortably ask for help. And for me, analyzing my numbers is one of those places. I want help. I want to outsource that. I don't want to think about it. Um, I also find that my mind tends to make up stories for what I'm seeing that aren't always based in reality, right? I might think I don't know, I'm struggling to come up with an example, but maybe if I think that I'm running high on my third day of my infusion site for my insulin pump, but if I were to sit down and look at all the data, I would find that is not necessarily true at all. It's just a story my brain made up. And so being able to talk through some of those stories with again, kind of a neutral third party, an expert who's very good at at looking at all that stuff, very helpful.
Yeah, absolutely. Yeah. Especially when the provider's, really asking those open-ended questions to kind of understand like what's going on, what are the patterns that definitely can bring um an extra not only lens, but I think even just like recognition of, oh, like I didn't even think about,
Yeah.
these different things that can affect my day.
The other thing that comes to mind for me when you talk about the value of connecting with other people living with diabetes is I found so much a sense of normalcy, right? I would tell myself that, oh, I'm really bad at estimating my carbohydrates. Something's wrong with me. This is like I suck at this part, and but in reality, it's pretty challenging for a lot of people with diabetes. And so it gave me a sense of normalcy there where I didn't have to feel so hard on myself around that. The other thing that it added for me was, as you just mentioned, so many different perspectives on some of the problems that we often, they're the same problems in our different life circumstances. And maybe if you, Jenny, approach it in a way that I hadn't thought about before, it can really open up my horizons on possible solutions.
Totally. Yeah. Yeah. I see big, big value in getting to know other type ones. When I first was ever around other type ones, I did a type one camp.
Mhm.
And at that time I was little and I used to be really afraid of injecting myself. I was on a pump, but I would still be afraid, not so much to use a pump, but just use like a needle. And it wasn't until I saw other type ones kind of just doing it so easily that I was like, "Okay, it's not that scary. I can do this." So, there's so much value in just even seeing other components of how people manage their type 1, how people live with it, that can be so valuable.
Yeah. Do you find that there is, you talked about kind of the stories that we tell ourselves in our minds, and sometimes how they're not necessarily accurate or factual, and can that color some of our relationships that we might have with those who are close to us and where like our parents or our spouses or loved ones or kids even. Tell me a little bit about that and how you see that coloring those relationships.
Yeah. I think sometimes with, our relationships, we want that support from those that are close to us, but sometimes those that are close to us also might think what's best for us looks completely different than how we might approach our diabetes care, right? And they might actually see the highs and the lows might be more of urgency for them, right? Like, oh my goodness, like what's going on? What do we need to do? Um, but I still, for a while, I would think, "Oh my gosh, if I when I was younger, if I tell my parent, like, my blood sugar has been higher lately," they were going to get upset that I did something wrong. But I think having the conversation with, your either your parents or a loved one, someone that you're close to, maybe live with, that this is happening and you are maybe working on it, but you just want to kind of express what you're going through and what it feels like and maybe politely say, not that I don't want advice from you right now, but I just want to be able to go to a trusted person and just let them know how I feel about it without feeling judgment. That can be helpful, just opening the door of how you feel, how you're managing it, with but also letting that loved one know that maybe we don't want to hear advice right now, but we just want to be able to vent to them and just, talk about what's going on with our care.
Yeah, it's something I need to keep in mind, more often with my wife, right? She'll come and she'll tell me something, and I jump right into problem solving and solutioning, and she's just like, "Dude, I just want you to hear what I'm saying. I don't need solutions. Like I figured I'm smart. I figured it out. I don't need solutions, but just hear me. Let me get this off my chest for a minute." Yeah, such a good point. When I think about someone who's maybe they've carried this these diabetes emotional baggage around blood sugars for such a long time that it's almost automatic for them, and they're having trouble maybe remembering to create that space. Is there any, like, a short little mantra or a quick thing? You mentioned the 1 breath earlier, or counting till 10, after seeing a number, something like that. What are some quick tips that people might try?
Mhm. Yes. I think even just, um, really thinking about how we can just pause in that moment. And I sometimes I don't want to add another alarm to our day because I know we have tons of alarm, but sometimes that is sometimes helpful. Like adding that alarm around mealtime to just signify, okay, I know I'm gonna look at my blood sugar because it's mealtime, but I'm also gonna take this moment to pause. That can sometimes be a cue for some people if you're someone that likes to have like that reminder. Um, I think having a piece of paper next to your meter or maybe around where you're going to eat. I used to do that sometimes, and I would have like a piece of paper and just kind of write down like how I was feeling right before or right after. That really helped me kind of see things. That was really helpful. Yet having a mantra, I used to have on my phone like a little mantra app. And it used to just have like a little thing that would say like your number does not define you. And I had just put that on my phone, and anytime I looked at my phone, I was like, "Okay," like, as a little self reminder. But, yes, I feel like mantras can be so helpful too, and putting them in places even, like, by your meter or, on your phone, that can just give you that little nudge and reminder.
Yeah. Can you also talk about ways that you've seen healthcare providers and healthcare professionals, um, maybe even unintentionally reinforce some of that shame, and what maybe feels more supportive? And with that in mind, how, like me as someone living with diabetes, if I hear an unsupportive comment or remark from the clinician I'm seeing, how might I address that? What can I say to try and shift that narrative a bit?
Yes, yes, I know that often happens, right? I had mentioned a little earlier how sometimes you might have been in range, now your provider's looking at it and they're like, "This is amazing," but they don't know what maybe it took for you to really maintain
Right.
that. And some that, you know, restrictive eating, avoiding certain foods, sometimes a lot of things that you might think, "Wow, this is just adding actually more stress, but I finally did achieve this goal my provider had for me." So that happens, right? I think often providers might use a lot of like the good and the bad terms around glucose levels that kind of reinforces like, oh, I this is what I need to do. And sometimes us as the patient, we feel like we need to satisfy the goal that the provider gave us.
Yeah.
And for some things I always remind patients is I know it can be hard to kind of have that conversation with a provider and kind of step up and say like, "Hey, I like a collaborative approach. I want, our care together to feel really collaborative." But asking the provider, when they say things are good, um, letting them know what it took for you to get there, right? I think being honest and saying like, "Hey, I actually like this. I did this, but it caused a lot of burnout and I don't want my diabetes management to look like this. What are other ways we can explore this? What are other
Mm.
options so I don't feel this burnout?" Really asking them for that guidance, I think can be really helpful. But I do know that sometimes some providers, it might be a little hard to get that confidence to have that conversation. But hopefully, you can also, if it's not directly with your like endo, let's say, maybe you have other people that are part of your team that you feel more comfortable. Like if you, work with a diabetes educator or registered dietitian that you have more time with in a session that can really guide and help you to kind of have more explore different options or maybe even explore how to, you know, advocate for yourself in those settings.
I love the approach of using questions, right? Because it seems to me, I can imagine that is a really powerful way to diffuse any tension that might be built up, right? If it's questions that come across seem a little bit more collaborative and more teamwork approached versus, you know, "Just- you're making me angry right now and this sucks and I want out of here." I like the idea of having those questions. I also really appreciate your awareness of that, just seeing a number is there's always a story attached to all these numbers, right? Whether it's our A1C or a single blood sugar or even just a single glance at a CGM, there's always a story that is involved with every one of these numbers in our lives. And um, even for like, let's say with an endo, where you going over your A1C results, maybe the endo can just ask, like, how does that feel for you? Okay, here's your A1C. How does that feel? And that seems like it would open up the questions, the topics of being able to share more comfortably about, yeah, this A1C is my lowest ever, but I really sacrificed a lot to get here. And the other thing that comes with those A1Cs is, and the goals that we're all working towards, it's one thing to meet those goals one time. It's a whole nother thing to sustain that for long periods of time. And that's really what we're after, right? It's more the sustainable, healthy, good enough diabetes management.
Absolutely. Yeah. Yeah. We're thinking long term. We don't want to do something where it's just for this week, just for the next 90 days before you get your next A1C. But what does long term look like for you? And how can it not be something that becomes such a burden? We want it to feel like small goals, small steps that we take every day that lead to that sustainable approach.
Yeah. Well, we've got time for a couple more questions. If someone is maybe feeling like they have to be hard on themselves in order to do well with their diabetes management, I can see that setting it up to be a little bit more challenging to do some of the things that we talked about today. But I also think it's a very common approach where we feel like we have to be hard on ourselves to do all these things. Have you have you dealt with that before? And what are your thoughts on that scenario?
Yes. Yes. Yeah. I used to feel like the only way I would get into the goals I needed to hit was if I had the discipline. That was always my word. I
Yeah.
was like, I need to have the discipline to do this. And I realized that it's not so much um the discipline, because the discipline was actually leading me to burnout because it was what comes behind the discipline. Oh, I need to do this and this and this and this. And it was too much planning where it didn't allow for things that came up with life, right? Um, so it was too rigid. So instead of that, I know that, sometimes we need some of that, like, gentle reminders or maybe some boundaries in order for us to maybe shift to, okay, how are we going to approach my diabetes care? But I think just starting with taking it back instead of thinking of it as like, you know, I need to get this perfect. It's like, what's the one step? What's the one thing I can do today? And maybe the one thing is, well, you know what? The one thing is I have time for breakfast at my breakfast so I can make sure I have a meal that is satisfying, balanced, and I can also include a walk right there. And that's what we do. And maybe lunch looks completely different. Maybe dinner looks completely different, but the next day, you kinda just ask ourselves, like, "What is the one piece I can do that will aid in the goal maybe I'm achieving long term, but also give me more of, like, that self-care approach to how I
Yeah.
manage diabetes?"
I love that approach too. And even if it's something that you break down even smaller than a day, right? Like if you are having a hectic morning and you're like, man, I can't even imagine what lunch is going to look like. But what's one thing I can do now that brings me closer to feeling good about where I'm at with things versus pushing me away? And I'll deal with lunch later on. I don't need to even worry about that, right? It's so often an hour by hour, minute by minute thing. Well, Jenny, if you wanted someone to take just one thing away from this conversation today, what would that be?
I think I would honestly say is you are doing your best. You are truly doing your best. I wish more people said that to me. Um during when I was kind of going through like how do I best, find that sustainability? But no matter if you're seeing the highs or the lows, you are truly doing your best and you are just human and chugging along. And there's so many other things going on around you that you also have to navigate. So keep at it every day.
I love that. And you're definitely not alone. We are right there with you. Yeah, well, thank you. Well, for everyone who joined us tonight, I hope that you're leaving with a sense that you're not alone in these experiences and that those feelings that you are having, maybe of sometimes shame and guilt, they're not a personal failure, but something that many of us carry, and many of us have to kind of proactively work to straighten out our self talk around. And maybe more importantly, it's totally possible to start shifting that relationship towards something more understanding and flexible and more compassionate. Jenny, thank you so much for being here and bringing such a thoughtful and really just warm and human perspective to the conversation. I think you made a topic that can feel heavy a little bit easier, actually, a lot easier to approach. And that really, really matters. So thank you so much.
Thank you so much for having me.
Absolutely. And if you'd like to learn more about Jenny's work and Diabetes Digital, we'll make sure to share links and resources with you after the webinar, along with the recording today. And then remember to check our website events page to stay up to date on future Blue Circle Health events. That's at bluecirclehealth.org/events. The next event is actually a cooking class with Rita on Monday, the 13th. And then on May 12th, Melissa from Abundant Health is going to be talking with us about hormones and blood sugar and midlife changes for women living with type 1 diabetes. Again, you can find more information and register at bluecirclehealth.org/events. And then we also have new podcast episodes releasing every couple of weeks. The podcast is called Around the Circle, Living Well with T1D. You can find more information on the podcast along with links to recent episodes under the news section of our website. Thanks again for spending this time with us, and I hope to see you again next time. Thanks, everyone.